This is the OEC skill video for boot removal. On the OEC practical exam, boot removal is usually tested as a skill station, not as part of a scenario. According to National Ski Patrol, on the OEC practical exam, a skill station does not require you to perform an assessment. You will be told what the injury is. You must still confirm scene safety, apply BSI, introduce yourself and obtain permission to treat, check CSMs, select the correct equipment, ask for assistance if appropriate, properly treat the injury, and then recheck CSMs. Note that the skill guide in your textbook does not require you to check CSMs prior to removing the boot. The checklist for the OEC practical exam does require you to check CSMs before boot removal, and it is a critical fail item if you do not. In real life, it is expected and best practice for you to assess and document CSMs prior to moving or manipulating any injury. This is the skill guide for boot removal. Confirm scene safety. Initiate standard precautions. Introduce yourself and obtain permission to treat. Rescuer number 1 will stabilize the boot and leg. Prior to any manipulation, assess CMS or CSMs. As always, address all three components of CMS: circulation, motor, and sensory. Assess circulation and sensory status by asking the patient if there's any numbness or tingling, and if their toes are warm. Assess sensation by asking the patient if they can feel their toes. Assess motor function by asking the patient to wiggle their toes or move their foot. Rescuer number 2 will unbuckle and unlace the boot completely and spread the boot open. Rescuer number 1 will stabilize the injured area of the leg or ankle by placing one hand on the front of the ankle and one hand on the back of the ankle, and hold this position firmly as the boot is removed. Rescuer number 2 gently removes the boot by sliding the heel away from the foot, followed by the toe portion. Monitor the patient for indications of excessive pain, and stop or modify the procedure as appropriate. Reassess CSMs or CMS. If you are applying a splint, prepare and apply the splint, keeping the movement of the injured extremity to a minimum, and reassess CSMs after the splint is applied. Treat for shock if appropriate, and prepare the patient for transport. In this video, a quick splint was applied on the hill, and the boot is being removed after the patient has been transported to the first aid room. Under some circumstances, it may be appropriate to remove the boot on the hill. This will be determined by your local protocols. The rescuers have confirmed scene safety, have standard precautions in place, and have introduced themselves to the patient and obtained permission to treat.
Push down my hand. Pull back up on it. Do you have any numbness or tingling? Push down my hand. Pull back up on it. Do you have any numbness or tingling? It's right here. I've done that one before. Yep.
Some pro tips for boot removal. Both rescuers should definitely wear protective gloves during boot removal. The rescuer placing her hands in the boot may find bleeding from an open fracture or just gross stinky socks, and she should be wearing nitrile gloves. The rescuer manipulating the boot is at risk for being pinched or cut by the boot buckles and should at minimum wear nitrile gloves or may choose to also wear work gloves. Remove the boot from the uninjured leg first to see how difficult it's going to be and to familiarize yourself with the specific buckles and fasteners on this model of boot. As seen in the video, you can use your chest or belly, elbows, or forearms to help stabilize the boot while you work on the buckles, being careful to avoid putting any pressure or leverage on the site of the injury. At the skiway, we have an assortment of tools which you can use to partially disassemble the boot if that will make removal easier. The patient's race coach or parent may be helpful, especially when faced with a difficult racing boot. You may want to consider waiting for an advanced life support provider, paramedic, to arrive to provide pain control before performing boot removal. Refer to the video on femur fractures for our local protocol, which determines that we prefer to remove the boot at the scene on the hill prior to application of a traction splint under most circumstances. Our local protocol is that rental boots, including daily rentals and long-term leased boots, should be impounded for possible testing of the bindings after any injury, so be sure to secure them along with the patient's skis. And consult your supervisor if there are any questions about what to do with a patient's boots or skis.